So far we have done rate and rhythm. Now comes the tricky bit, and that is finding out the axis on an ECG. Now, if you remember that a 12 lead ECG, in fact, does not have 12 leads, it has 10 leads. And out of those 10 leads, there are 4 limb leads and there are 6 chest leads. These 4 limb leads are like this. So draw a line like this, and then another one like this, and the third one comes like that, and draw an arrow here, draw an arrow here, and another one here. But then parallel to these lines, draw some other lines. One line is here, the other line is here, and there is one line in the middle, which is like this. So these are your limb leads. This side is minus and this side is plus. The reason being because the SA node is located on the right side. That means towards the right shoulder. And the AV node is towards the left side. So the electrical current flows from the SA node towards the AV node. And this is the direction of the electrical current. And we know it flows from a negative to a positive terminal. So therefore, the left side of this chart, this is positive, depicting the left side of my body, and the right side is negative from where the electrical current is flowing. So all the arrows which are pointing on to the right side are those arrows which will actually give a positive wave. That means where the electrical current is flowing. I'm going to label them now. This one is lead 1. This arrow pointing downwards, this is lead 2. This arrow pointing downwards is lead 3. This one pointing towards the right shoulder is AVR, which is this one. This one pointing towards the left shoulder is AVL. And this one coming exactly in the middle is AVF. So in this way, the limb leads will cover the whole of the heart, from the right to the left side. The normal cardiac axis means that the normal flow of current is like this. This is 180, this is 0, and this has 2 signs to it. This is a positive and negative 180. So you've got a negative 180 and then you've got a positive 180. And here is 90, this is plus 90, this is minus 30. The normal cardiac axis is this one. Minus 30 to plus 90. And wherever the axis is, as long as it's in this direction, we call it a normal axis. So if the axis is minus 10, it will be a normal axis. If the axis is plus 60, it will be a normal axis. And this axis can be calculated from these different leads. So in other words, if I was to look here, the axis normally will fall somewhere here, and this is the normal direction of the cardiac axis. So it covers lead AVL, lead 1. So I can see in lead AVL, lead 1, lead 2, AVF, and AVR. So if I use these leads, then I can calculate the cardiac axis. Lead 3 will actually be helpful when I'm measuring the axis, keeping in mind the AVL. Now, what I've got here is an ECG, and I'm going to show you how to calculate a cardiac axis. In this lead, you can see this is 1, 2, 3, AVR, AVL, and AVF. Right, forget about the chest leads. In lead 1, we see the QRS complex to have more of an R wave, and the R wave is a depolarization wave, which tell you which way the vector is flowing. So in lead 1, in this particular ECG, we've got more of an R wave, so therefore the axis is on towards the left side. But if you can see, you can actually see a blip of the S wave as well. So that means the S wave means it's a negative wave. So the axis is towards the right side because all this is negative. So it's not exactly here. So the axis is probably a bit like that because you do get an S wave here. In lead 2, we get an equivocal QRS complex, which means it's neither positive nor negative. And let's see where lead 2 is. So this is lead 2, and this is an equivocal one. So had it been onto this side between 1 and 2, the R wave would have been positive maximum. But because the R wave isn't that high and the S wave is present as well, which means that in lead 2, the axis is somewhere between AVL and lead 1 in lead 2. So this is upwards. And then comes lead 3. Lead 3 is this one, and we see that it's a negative wave pattern. So we have no R wave and we have an S wave. And that means the vector is not pointing towards this way, it is pointing exactly opposite to that, towards ABL. Once again, falling in this region. So it's probably in the region of ABL. So meaning there where this ECG shows that there is left axis deviation and not a normal one. And this can be confirmed by looking at AVF. So far we didn't really worry about the AVF, but this is where the AVF for an AVR and AVL comes in. You look at AVL, AVL is mainly positive, so the vector is towards AVL. You look at AVF, it is all negative, so the vector is up towards the negative side. That means the vector is around here somewhere. And then you look at AVR, and the AVR is negative as well. So that means the vector is not here. So the vector is around here, and this becomes, looking at AVF, so this becomes left axis deviation because you've got a totally negative wave pattern in AVF. So this is left axis deviation on this particular ECG. Had it been right axis deviation, I would have had a positive wave pattern in AVR. So if you've got a positive wave pattern in AVR, this is called as a right axis deviation. And then you've got two types of right axis deviations. You've got an extreme right axis deviation. I beg your pardon. You've got an extreme right axis deviation. And you've got an extreme left axis deviation. And that all depends on which way it is flowing. So if it's on this side of AVR, that means this being the box of AVR. So if it's, draw a line here in the middle, if it's on this side, this is called extreme left axis deviation, and if it's falling on this side, this is extreme right axis deviation. If it's falling on this side, this is right axis deviation. And in right axis deviation, let's see what would we get in right axis deviation. We'll get a negative in one, so we'll get a negative in 1, right, because it's falling on their side. We'll get a positive in lead 3, and then we'll also get an equivocal or a bit negative in lead 2, and then we'll also get a positive in AVF. So if you get a positive in AVF, we've got a positive in lead 3, but we get a negative in AVL, we get a negative in 1. This becomes right axis deviation. So in this way, you can calculate the right and the left axis deviation. Thank you.